And the Health Advisory Committee is chaired by our Honorable MLA of Nongpo, Mr. Merrill Bonds A. And we had a brief consult with the board, and we thought that it would be in the fitness of things to ensure that while creating these boards, which have been for so long alleged to be mere political appointments, we thought that we would go out of this common practice or common belief and assign certain assignments to the board. And I was happy to have had a detailed discussion with them, wherein I have requested them to uh, get into a project that would be looking at commercial sex workers and what is the kind of advisory that this health advisory board could give to the health department, so that we can ensure that we take positive steps towards the discussion of commercial sex workers. What should we do for this group of citizens? What are the things that we need to look at? What are the challenges? What is happening in the debate about commercial sex workers? Looking at the dynamics of the increase, the proportionate increase that we see in HIV/AIDS in the state of Meghalaya. If we do not sit down, bring to the open, and discuss this agenda, I think we would be shying away from that responsibility of actually looking at what needs to get done to ensure that citizens are safe, citizens are advised, citizens are monitored, irrespective of the kind of engagements that they have in their everyday lives. This is one area which the Health Advisory Committee will now look at, and I hope that we will be able to gain necessary inputs from these kinds of boards and these kinds of committees, so that government can take necessary decisions that would avert an otherwise explosive situation in several implications in the health sector. Uh, the chairperson of the chairman of the board also thought that it would be in the fitness of things to allow them to study and to allow them to engage with experts to discuss the matter of traditional medicines, traditional healing, traditional, uh, you know, traditional practices that are anyways very popular in communities across the state of Meghalaya. We have seen that there is great potential in some of the medicines or the medicinal practices that are there in this sector of work. We've seen that we are now hand holding traditional healers through various Government of India schemes. They're getting the adequate attention, the adequate financial inputs to help us look at a possibility of our traditional medicines that may as well get popular and gain importance in the entire spectrum of traditional healing systems. So this is one thing that we're looking at. And again, I just came back from Mokurwa, Southwest Khasi Hills district, and it is still alarming to know that pregnant women are still opting traditional healers for deliveries. We have fought the system for so long, and I feel that it is just correct for the Department of Health, who has anyways been looking at this important concern of involving the training of dyes or the traditional helpers who help women deliver their babies at home. We are looking at this big gap in in institutional deliveries in that district alone. And I was under the impression that since we cannot deny a citizen of the right to decide whether they'll have the baby at home, in a sub-center in their own village, or will they come to a government facility or a private institution to help them deliver their baby safely, to take into consideration both mother and child health in this entire situation. So now we have to start looking at the integration of traditional practices, medicinal practices, and we have seen that government of India now is concentrating a lot on Ayurveda and Ayush and homeopathy. So these are all the different forms of practices in the country and in the nation that are receiving the correct attention. So the advisory board now will look at these two important segments and give valuable advice to the government as to how we can go about and get over this entire problem that we are facing in the community today.